We now head to Southern Africa, where South African leaders have wrapped up their summit in Harare, Zimbabwe, with a focus on the growing threat of Mpox. The 44th Southern Africa Development Community Summit saw leaders discussing the continent's challenges, including the spread of Mpox to over a dozen African countries. SADC Executive Secretary Elias Magosi announced that an emergency meeting of health ministers will be held to coordinate a response to the outbreak. Now, the community or meeting aims to facilitate a unified approach to combat the spread of Mpox in the region.
We have amicably come to a conclusion where the SADC were all agreed on the issues and challenges facing our region. Meanwhile, we pay special tribute to the sacrifice and contribution of the SADC forces in the now closed SADC mission in Mozambique, Zambia, and the ongoing SADC mission.
Now joining us on the news to discuss more on the cholera outbreak is a medical practitioner, Dr. Taufik Sani. He's a consultant physician at Federal Teaching Hospital, Ido, Ekiti State. Hello, Doctor. Thank you so much for joining us this afternoon. Can you hear me?
I can hear you now.
All right. Thank you for joining us once again.
Thank you for having me.
Yes. So let's talk about the Mpox outbreak in Africa. Now, tell us, what are likely the factors that are contributing to the recent surge in Mpox cases in Africa, even in Nigeria, as we know we have over 30 cases?
Yes, thank you for having me. Before now, the Mpox disease is endemic in Central Africa and some part of West Africa, especially in Democratic Republic of Congo. It is endemic. However, recently, because of globalization, increase in traveling and movement across borders,
Hello, doctor. Can you hear me?
trade. Hello, yes, I can hear you.
All right, please go ahead.
I said because of globalization, increase in movement across borders, and also increase in trade and traveling, we've had import of these diseases from the areas where they are endemic to new areas, and also because of reduction in our surveillance system, where at our borders we don't actually screen for Mpox. This has also increased the importation of this disease from areas where they are endemic to new areas where they are new. So I will say that globalization, increase in trade, increase in traveling, and reduction in our surveillance system is the cause of this recent epidemics that is crossing borders and not happening around the world.
All right, doctor. Now, this is a different strain, from the one that happened in 2021. And now, can you tell us, how do you think that this new strain of Mpox virus differs from, the previous strains in terms of transmissibility, severity, and also clinical presentation?
All right, thank you. Yes, the Clade 1 strain that is causing this present epidemics is actually endemic in Central African area, while the Clade 2 type is endemic in Western Africa. The 2022 and 2023 epidemics was caused by the Clade 2 strain. However, this Clade 1 strain that is new to all other areas is only endemic in Central African region. It's not only very severe, it also has a very high transmissible rate, and it's also very fatal. It causes a lot of death. So it is a more serious, more fatal, more highly transmissible, and more severe strain of the monkeypox virus. So the initial epidemics we have in the past is the Clade 2, while the one that we're having now is Clade 1. It's also more endemic in Central African Republic, where they might have developed some level of immunity But for areas like the Western African area and other parts of the world where this virus has not been seen before, it's a new strain that is causing disease in them, and that disease is more severe. And usually comes with symptoms like fever, fatigue, sore throat, and the kind of rashes that it causes. It's a rash that we start from the face, spread all over the body, common on the palm, the sole, the genital area, the mouth, and the anus. And they usually come in form of, initially in form of some maculopapular rash, then it will become blisters that will have some pus inside. It can be itching, it can also be painful, and later,
Okay, Dr. Sani, if you can hear me, can you hear me, Dr. Sani?
can last between 2 to 4, 5 to 21
All right, Dr. Sani, we actually lost you for a bit there, but let's move on. From what we know, this particular strain of Mpox has been declared a health emergency in Africa. And then from what we know in Nigeria as well, we're expecting 10,000 doses of vaccine. Now, what would you say are the most effective strategies for preventing the spread of Mpox, especially when you talk about high-risk populations and also regions?
All right. One of the things we can do is what we are doing now. Let us increase awareness. Let people be aware that we have Mpox around us. And with this, we can also describe the symptoms to the people around, so that when this is seen, it can be reported. That is increasing our surveillance for Mpox. And for individuals who have Mpox, they can be isolated and treated. Also, preventing mechanism like distancing ourselves from people who are infected. If we are caring for them, we need to put on our face mask, our hand gloves, so that we don't have contact with their body fluid and directly with the soil on their body. And also thorough hand washing, using hand sanitizer, can also be a protective mechanism. And also with vaccination, we can also control this disease. Luckily for us, this Mpox.
Okay, doctor. Just before you go ahead, we've actually had other doctors, on this channel speak to us on Mpox, and some of them seem to think that, considering that it is not a pandemic yet, it is just an endemic. They feel that the whole emergency that's the whole health emergency or health care or health scare should not have been, announced by the WHO. Do you agree with them?
Yeah, it is. Of course, it is endemic in Central African region, and it is more in them. However, we've had instances like it's now moving out of Africa, and WHO want to be proactive. The World Health Organization thinks that the earlier we start preventive measure, the better for us, because we don't know how much impact it might have on the health of individuals, especially those who are not known to this disease before. We know that for almost all diseases, immunity will be formed. And for individuals whom the disease are endemic in their area, they will have had some level of immunity. They will have had some level of immunity. However, for individuals where the disease has not appeared before, the level of immunity may not be that much, and they may not be able to protect themselves against the severe effect of the disease. And the fact that the class 1 type that is more severe, that is also causing this, we must put in of course, we may not put in the full-blown emergency care, but we must make people aware, and we must begin to teach people on how to prevent themselves from contacting this disease. Breaking the chain of transmission is important to curtail the spread of the disease in our community.
All right. Well, thank you so much, Dr. Sani, for speaking to us on this.
Thank you for having me.